Complications of face and neck lifting. I would like to talk about. These I think are things that are really important to understand when considering face lifting or neck lifting. Scarring, incision scars from a facelift are permanent and typically concealed or well located. Sometimes they can result in visibility, particularly if you've got short hair, and sometimes they can be poor scars which are raised or red and need further treatment either by revision or with corticosteroid injections. Swelling and bruising, it typically goes, at least with visible bruising, by about 2 weeks post-op, but it can be prolonged if there's more bleeding under the skin, and some people just get that. If bruising is slow to go, you can consider it as a complication, but it usually just is a variation of the way people heal. Most people can resume most aspects of their life about 4 weeks after a facelift, but leave at least 6 weeks before any important social or personal events. So these estimates are guides only, and in some cases recovery can be shorter or longer. And prolonged visible bruising occasionally occurs, which can mean changing your post-op plans or return to work plans. Changes in skin sensation. During a facelift, the repositioning of the tissues affects superficial sensory nerves. Everybody feels some facial numbness around here. After a facelift, mostly it recovers. It doesn't always recover. It doesn't really matter. Hair loss. You can experience temporary or permanent hair loss near the incision sites, particularly around the temple. Largely that's a technique thing, but some people are prone to it. So I have seen that, it's pretty rare. Facial nerve injury. The whole way facelift surgery is designed is to not injure the facial nerve, which is the main motor nerve to our face, which drives the muscles that allow us to express. Rarely, facial nerve injury can occur, temporarily through stretching, in which case it will recover, but if it's permanently injured, then you'll have a patch of tissue that doesn't have the normal expression and can result in either the need for further surgery or permanent asymmetry. Permanent facial nerve injury, in my experience, has been extremely rare. Skin loss, much more common in smokers. So a facelift elevating the skin can result in loss of blood supply to some of the skin flaps and a wound breakdown. I've rarely seen this, really only in smokers. And also the risk of bleeding, infection or other skin or wound complications can occur. After a facelift, you can get lumps under the skin that need to be treated or that you're aware of. There can be changes in your earlobe shape, particularly if you've got an attached earlobe. Then after a facelift, the way it attaches to your head will be a little different. The sideburn may be changed. In facelifting, part of modern technique of facelift is to avoid much hairline change around the temple. But if you've got significant skin laxity, some hairline change in appearance, and the position of the scars here requires discussion as it may be different after surgery. It most likely will be, and you may need an incision that even runs around the sideburn in front of the hairline or at the hairline junction if there's a lot of skin to elevate up to avoid creating a bald patch for you. Scars behind the ears can be thick or lumpy and quite often are a little gathered for a while but settle down with time. The scar around the lateral face usually goes behind the tragus, which is this little structure of the ear, and sometimes they can be not ideal. Facelift can result in permanent expression changes, so the way that you express may be different after a facelift. You can get facial asymmetry after a facelift, and most people have it before surgery, and typically a facelift will either improve it or leave it kind of the same, but some people have worse or more noticeable facial asymmetry after a facelift. Your wrinkle patterns can change with a facelift, sometimes in ways that are unappealing. You can create temple looseness or wrinkling if a lot of skin elevation has been done here, but the temple hasn't been adequately addressed. Neck lifts have the same kind of procedures. Probably a thing to add for neck lift is visible skin or muscle irregularities and visible poor neck or skin scars. These can occur after neck lifting. Visible lumpiness can occur under the skin if there's muscle bands or an obvious submandibular gland or fat that hasn't been dealt with. So it's quite a list.